Hey y'all, checking in and letting you know what's been going on with me. Ooh, I got the my therapist refers to this as my forest witch look, and I'm gonna go with that with this hair. I don't even care right now. Anyway, it's been a lot, guys. It's been a lot. I If you watched my videos, you know that I was finally put on an opioid pain med for the joint and muscle pain that I've been dealing with for a really long time. And I had a good month of being almost pain free. It was pretty wonderful. It really gave me back some quality of life. However, my insurance company decided I no longer need to be on that medication and they will not approve it. I'm choosing to try to look at the bright side, even though I'm not one of those for toxic positivity. I myself had to just drag myself out of wallowing in self-pity, I guess, or whatever you're going to call it, because I had to go off the medication last Friday. I had a few days, about 3 days of being very weepy, very depressed, having some dark thoughts. I believe that was probably a combination of coming off the medication. I wasn't on it that long. I mean, I was on opioid pain meds when I had my mastectomy and when I had my ankle surgery for 6 to 8 weeks and didn't have a problem coming off of them. I think a lot of it had to do with just being in pain again. I will say that the pain level is not as severe as it was when I first started the pain meds. I think because those 2 months, the first month of reduced pain, the second month of hardly any pain, allowed me to work a little bit harder in physical therapy, which is what my goal was. My goal was never to be on pain meds for the rest of my life. It was just to not be in pain. And physical therapy is the only treatment for Ehlers-Danlos. So it kind of became, they go to physical therapy. Well, I'd like to, I'm in pain. So anyway, instead of a 7 to 10 pain, like all the time, I'm about a 3 to a 7, depending on what I'm doing. I am like not using my walker to get around my house, but I'm kind of taking it with me when I know I'm going to have to be on my feet for an extended period of time so I can sit down, because my POTS is also like just standing and my heart rate will go like 145, and then that makes me dizzy and makes me feel horrible, and then the low back pain kicks in. So finding modifications that I can do to help myself. And the other big thing is I have officially been diagnosed with MCAS. I've had it for years, but couldn't find a doctor that would even take me seriously. I mean, there's so many doctors out there that don't even know what it is, let alone have any idea on how to test for it, what to do to treat it, any of that. And it is really difficult to diagnose because, the things that they look for, you really need to be in a pretty severe flare, if not anaphylaxis, for them to catch it. And possibly maybe another silver lining to being on the opioid pain meds, which are mast cell degranulating and can cause a lot of mast cell issues, is that the doctor that I went to last month did some testing in urine and blood, and we did catch a high in one of the tests that does signify that I have, or signal that I have, MCAS. So he had prescribed cromolyn sodium for me, which is kind of the first line of, you do the H1, H2 blockers and then maybe add the cromolyn sodium. And I know there's a few other medications, but my insurance denied it. Hopefully now that I do have an official diagnosis, they will approve it. So I will say that my daily nausea during the day has been down since no longer taking the pain meds, but I have been taking a Benadryl every night because, if you have MCAS or you have histamine intolerance, you know that your body naturally releases histamine at night. And when that was happening, I was becoming nauseous and vomiting every night. So I have just been taking Benadryl every night. I was a bad girl last night and I had part of a cheeseburger, and I know that's high histamine. And after I ate about a third of the cheeseburger, not even a third, maybe, I did feel kind of a little and so I took 2 Benadryl before I went to bed last night. But I'm hoping in about a week I'm going to try not taking the Benadryl at night and see if being off the pain med is stopping that situation, because I don't want to be taking Benadryl every single night. Although last night it did help me sleep. I only woke up a couple times versus like every hour to 2 hours. So I don't know. Everything's kind of up in the air, y'all. I'm trying to figure it out and navigate, everything as best I can, and trying to remain as positive as possible, but also understanding that when I feel the need to cry, I'm going to cry, and I'm going to get it out, and that's okay too.